As a physical therapist, I can tell you that one of the most common reasons why people seek out physical therapy is for back pain. Hi, it's Dr. Sarah here, your neighborhood physical therapist. Back pain is also one of the most common reasons why people go to their primary care doctor's office. Depending on the study that you look at, between 45 and 80% of all people will experience back pain in their lifetime, and it's more common in the older adult population. Back pain is complicated because it can be caused by many different factors. And as a physical therapist, the exercise prescription is different depending on the cause of the back pain. This video is about sprains and strains of the back. That means that either the muscle, tendon, or ligament in the back was stretched beyond its norm, and that was probably due to lifting something too heavy or using improper body mechanics. You know you have a sprain or a strain in your back when the painful area is tender to touch. The painful area is on either side of your spine, not right down the middle. The painful area might be swollen, bruised. You might have muscle soreness or muscle spasms in that area. Here are my top exercises and advice for dealing with back strains and sprains. The first exercise I'm going to show you is called knee to chest. And so all I'm going to do is I'm going to take one leg and bring it in towards my chest. With my hands, I'm going to gently pull it towards my chest till I feel a small to medium stretch in my low back. The other leg, you can straighten it out or you can leave it bent, whatever's comfortable for you. And what we're doing here is stretching out our paraspinal muscles. Those are the muscles that run on either side of our spine. And what happens is when there's ever an injury to an area, it's very common for the muscles around that area to tighten up as a protective response. So those muscles usually extend or straighten out our spine, and what we're doing now is we're stretching them into a more rounded lower back position. You can also take the other leg and do both legs knee to chest for more of a stretch as well. Studies show that gentle stretching can reduce pain and improve function when someone has a sprain or a strain to their back. When you're done with this stretch, you can just gently bring your legs back down onto the floor. The next exercise I'm going to show you is called hook lying knee rotations, and all that is I'm here laying on my back and I'm going to allow my legs both together to go to the side and then back up to the center and then back over to the other side. And the reason why I like to prescribe this exercise is because people can control the amount of movement that they're doing with this exercise. So you're looking for a medium stretching or pulling sensation. And so you can go just a little bit of movement, or you can go a lot of movement and bring your legs all the way over, like nearly to the floor. So you can do, 5-10 times of this exercise, whatever feels good for you. Let's do a couple more together. Let's do 3 more, both sides. This is also stretching out those paraspinal muscles that are also responsible for rotating the spine. So that's why we're stretching in this direction. The next exercise is called a figure 4 stretch. Now with this stretch, we're going to be stretching out your gluteal muscles or your butt muscles. And in my experience, many patients consider pain in their buttock pain in their low back. And you can also strain this muscle when lifting. So that's why I included it in this video. So all you're going to do is take one side, you're going to cross it over, and you have your knee out to the side. So that's why we call this a figure 4, because it kind of looks like a 4 if you're someone standing by your feet. So again, I have both knees bent, and the leg I want to stretch, I'm going to cross it over the bent leg. And now if I'm not feeling enough of a stretch here, I can always bring my whole legs towards my chest, and I really feel it here. Sometimes patients tell me that they feel this kind of down their leg as well, and that's okay too. I can hold on to my leg and bring my legs closer to my body for more of a stretch if I want to. I can hold this for about 30 seconds. And I can also show you guys how to do this stretch sitting in a chair as well, if that's better. So when I'm done with this stretch, I'm gonna slowly let my leg back down, and then we can do the other side. I can cross my left leg over, knee out to the side. And if that's not enough of a stretch for me, I can bring my leg in towards my chest, holding this as well for about 30 seconds. So here's the exercise I wanted to show you in the sitting down position, that figure 4 exercise. So rather than laying on your back, if you want to, you could sit in a chair. You can have your back supported against the back of the chair if you want to for this. And say if I wanted to stretch out my right butt muscle, I would cross my right leg over. Kind of my ankle is at my knee area. And this right leg can go down kind of parallel to the ground. And if that's not enough of a stretch for me, what I can do is I can lean forward. I can lean into my legs, bringing my chest towards my legs, and then I feel a big stretch in the back of my right thigh and my buttock area. So you can hold this for about 30 seconds. Try not to bounce with the movement. Try to just have a sustained stretch and a medium stretch. If you were to rate it small, medium, large, you want to have a medium stretch. So when you're done with that, you can slowly bring your chest back up to a straight up and down position, and you can switch legs. And we're going to bring our chest down towards our legs. Holding this position for about 30 seconds. And I'm breathing this whole time. And when you're done with this exercise, just bring your chest back up to normal, both feet on the floor. So once my back pain is starting to feel better, something that I can do to start to strengthen those paraspinal muscles we talked about, as well as the gluteal muscles in your buttock, is bridging. And what you can do is you can start in this hook line, we call it position, with your knees bent, and you're gonna try to flatten out your low back onto the floor, and I do that by tilting my pelvis. So if you know that there's a little space in your low back, you're trying to flatten your low back onto the floor, tilting your pelvis back a little bit. And that's how the bridge starts. The bridge starts with this pelvic tilt up, pushing through my knees towards the other side of the room and trying to bring my buttock up in the air, and then slowly bringing my hips back down to the floor. So we roll up little by little. So the bottom part of your spine is going to leave the floor first. So I'm tilting my pelvis up, the bottom part of my spine comes up, and then as I go up my spine towards my shoulders comes up off the floor as well. And I can hold this for a beat and then slowly let it back down. Let's do 5 more of those together. Okay, so I'm tilting my pelvis and pushing through my legs, feeling a squeeze in my butt, and I'm coming right up to the top and then down slowly. Let's go again. Tilting the pelvis, coming all the way up, pushing my knees towards the opposite side of the room, and coming back down. And don't forget to breathe. Keep on going all the way up, feeling a squeeze in my buttock, maybe in the muscles of my back. And you always want to do these exercises pain-free. If you're having pain with this exercise, perhaps maybe your back is not ready to start the strengthening just yet. I think we have 2 more. All the way up and down with control. And 1 more time. Pushing through my heels, pushing my knees to the other side of the room, and then down gently. Okay, everybody, the next exercise I have for you is done on all 4s, and it's called the cat-cow exercise. And the reason why it's called that is because we're going to make our back kind of look like an angry cat by bringing our spine up towards the ceiling like this. And this is a yoga move, so we can do it slowly and really think about what we're doing. So here we go. We're going to bring our spine up towards the ceiling, rounding our back, and then slowly bringing it down, maybe even into an arched position, arched back, if that feels good for you. Let's try to do 5 together. Now, my patients that do yoga, that have back pain, love yoga because it's very slow and controlled motions. You can really think about what you're doing, and you can add breath to the movements as well. Slow inhales and exhales. I think we have 3 more together. Notice I'm keeping my neck neutral as well. And 1 more. And then you can bring your back to a neutral position. General advice is to apply ice to the sore area. In terms of body mechanics, try to bend your knees and not your back when you're lifting, and try to avoid twisting when you're lifting or carrying something heavy. Stay tuned for a video with more details about body mechanics coming up next week. Thank you so much for watching this video and subscribing. Did you know that tight hamstrings can also be related to back pain? Check out my video on hamstring stretching linked below, and stay tuned for more content.